What's the value of water? We explore the answers to this question and more as we sit down with Jenica Dizon, Executive Director at Waves for Water Philippines. I'm your host, Albert Orr, and this is Drawing on Hope, where we talk to inspiring people who will paint for us their vision of a better world. We're recording this conversation with Jenica in mid-July, just as a typhoon is sweeping across the Philippines, bringing heavy rains and flooding in many parts of the country. We'll jump right into the conversation, but before we do, click the like, subscribe, and follow buttons. It helps others find our show and be part of this movement for hope. We're talking to you today just as a major typhoon is sweeping through the country. How is your team doing? And how does weather like this affect the work that you do at Waves for Water?
So during typhoon or habagat season, this is really what we call a peak season for the organization. This is essentially, the roots of Waves for Water. Waves for Water Philippines began because of our global office's response to Super Typhoon Haiyan, and because disasters typhoons only further highlight a pre-existing need. We saw it fitting, to operate year round, not just as responders to disasters and typhoons, but really to help equip and build resilience in communities. But now we can see, our team has been busy monitoring flooding, areas that have been affected, because when you have flooding, that means primarily water infrastructure gets damaged or contaminated. Might not be a big issue or something top of mind that we think of if we live in the city and we have running water and tap systems, but for areas that don't have centralized water infrastructure, or they rely on wells, surface water, or rivers, groundwater, all of these get severely contaminated because of poor sanitation, and essentially, all your water will flow into the same pool. So it's really where we respond to. It's also our roots, and now it's really a lot of gearing up for multiple responses.
I want to deep dive into the work that you do and how you help address the issue of contaminated water. But maybe we can start with you first. What drew you personally to water?
I've always been a water baby. I've always loved the ocean. That was my first really passion in a way, marine conservation. But I never planned to work in water. Back at university, my undergrad, I was in management information systems, so a computer degree. And then I shifted into information design, where I actually had the pleasure of having you as my lecturer. So, my path was very winding in that sense and not straightforward. But I knew that I wanted to pursue work in the development sector. That was one thing I knew for sure. And I jumped multiple roles. My first job was in policy, then I did corporate sustainability, and then went back, did tourism, and then there was the opportunity to volunteer for Waves for Water. It was starting out in the Philippines, in Manila specifically. And, I just volunteered. I had spare time, and I guess that has been the longest volunteer role of my life that evolved into, a full-time role. And, 5 years, 5 years since I've been running the organization. So it happened very organically. I never expected it would end up running, as a volunteer. You think you're just going to get involved in small things until you really see why the work matters. There's a specific encounter during a disaster response mission actually in Batanes that really sticks to me. I was speaking with some fishermen while we were waiting to get transferred to an island, and was curious about the catch, but essentially they were fishing out of the waters. I looked into their sack, and I see creatures from Finding Nemo. I saw Dory, a blue tang, and my conservation hat, suddenly activated. I said, "Oh, how much are you selling these fish for?" Because I knew the Philippines was contributing heavily to the live reef fish trade. because a lot of people wanted Finding Nemo characters in saltwater aquariums in their homes. So this was my, automatic assumption. But they said to me, "Oh, this isn't for sale. This is food. This is something that we're going to eat later." And I was taken aback, primarily by my own assumptions and reactions, that I had a very elitist view of conservation and development work and really didn't have good grounding. It was a myopic view of what conservation meant, and communicating that to people, jumping knee jerk reaction that people shouldn't do this, shouldn't do that, wanting them, being frustrated that people weren't thinking long term about implications, about balance in the ecosystem. But really, people just couldn't even afford to think long term when all they're trying to figure out is where they're going to get their next meal, or if they're going to be able to get access to clean water. And I think being confronted with that reality, that, there are people whose basic needs, their human rights essentially being a luxury, was something that really cemented my commitment to Waves for Water, and making sure that, essentially every Filipino, everyone has access to clean water.
I want to dig into what you said was your elitist view of development work. You mentioned that even from a young age, you were already sure that that's a space you want to be part of. Where does that desire to be in development work come from? And how has your views about it changed over time?
So I think, because to a certain extent, I grew up with some level of privilege. I knew that there were things that I had access to that not everybody, would regularly have had. And I think my upbringing has a lot to do with this. Early on, my parents already instilled in us that, made us understand that we were blessed, and that with that comes a certain level of responsibility in also, doing our best to make sure that people also, had access to things that we had access to, or at least paving the way for that in however we could participate. My mom was a doctor, and early on she would bring us to medical missions just to, really see what it was like, for people who didn't live in the city, who didn't have relative access to easy healthcare, and just things that we thought was the same for everybody wasn't. I think that was clear to us from the beginning. But because of my roots also in conservation, I think there was a time when I cared more about fish than people. So I think realizing, caring about the environment is actually ultimately caring about humans. I think for me, that was where the elitism was kind of, focused on for a while, because I was frustrated about people, for example, who was logging, who was mining, who was dynamite fishing. But at the heart of that are people, take away big corp, the people, the individuals who take part in that are really just looking out for their families, want to put food on the table, essentially the same things that I have access to, they want to provide their children with. And I only got a better understanding of that the more I was exposed, and the more I was able to interact with people in the field and in the communities that we work with.
I think the same can be said about a lot of different advocacies, right? Whether it's animal conservation or environment work, it's really about getting to know the people who are involved in the ecosystem and working with them to come up with solutions. I want to dig into the work that you're doing now with Waves for Water. Clean water is a basic right of everyone. Everyone should have it. Would that be
Yes.
an accurate way of putting it?
Our founder says, the world has a lot of problems, but access to clean water shouldn't be one of them. It's actually a global crisis that's solvable, because the solutions are present. We just need people to put that forward.
Why is that important and why should people care?
Because I think more often than not, we don't realize that access to clean water, unless we're faced with not having it, it's existential. It's really the building block of development. When you think about your sustainable development goals and our commitment to achieve these by 2030, access to clean water is just one block. That's SDG number 6. But it's really the building block of it all, because if you're constantly getting sick by the water that you need to live, then adults aren't able to go to work, kids aren't able to go to school. If women don't have access to clean water, it makes giving birth so much more complicated. Women and girls are also the ones who menstruate. They're the ones who bear the burden of responsibility, often for fetching water for their household, so it also becomes a gender issue. It's also a peace and conflict issue. You see a lot of countries fighting for their water resources, boundaries being fought over because who gets to use which part, or who gets to use and access this river, this lake. You see that in the whole Israel and Palestine conflict. One of the first things that Israel did was actually shut Palestine's water supply. So it's also being increasingly weaponized. So really, water is the heart of a lot of things, even as an input in the food that we eat, in the products that we consume. So water is essential, it's existential, and it's the heart of a lot of industry and activity, and it's the building block of development. So water matters, and it's so easy to take for granted, but for those who don't have it, it really is a matter of life and death, and the key to breaking out of the cycle of poverty.
So, how is Waves for Water attempting to address this issue?
So, with Waves for Water, what we do is simple. We recognize that there are multiple levels of addressing access to clean water issues. When you think about water, what access to water isn't often an issue. I mean, right now in the Philippines, where we're experiencing an abundance of water, water is the primary manifestation of climate change. Either you have a severe abundance or severe lack of it. And right now we're experiencing, an overabundance, experiencing flooding. So often water isn't the issue, but the access to safely managed or access to clean water is the problem. And what Waves for Water implements is a medium term solution. So we understand that there are different levels of water supply, and level 3 is your centralized water infrastructure. This means there's treatment at source, and then piped in water is brought into households, and households have 24/7 access. It's safe, it's not contaminated, but centralized water infrastructure isn't often applicable to a lot of remote or upland, even island communities. It's capital intensive, so it requires a lot of money to build. And then households themselves need some level of purchasing power to be able to pay monthly fees for service delivery. Water should be free, but unfortunately, delivering it to our households uncontaminated needs to be paid for. So in the interim, where government has burden of responsibility for providing this infrastructure, in the interim that's on its way, or fundraising is still happening, budget allocations are still in the process, families, households now have to rely on contaminated sources, either direct, the fetching from surface water sources, from groundwater. So you have your deep wells, your hand pumps, your pozo, your springs, and these are often prone to contamination. So what we implement are filtration systems that have a very fine membrane. So this membrane traps all your bacteria, protozoa, and cysts that often cause waterborne diseases. So there are limitations to it. It's not desalination, for example. It can't remove heavy metals. But in areas that we work with that are very much prone to waterborne diseases, your typical diarrhea, cholera, salmonella, all these that are easily preventable, easily treatable, but because of a lack of healthcare access, makes them, a leading cause of death in some communities. These are what we want to prevent through simple filtration systems.
When you talk about the work that you're doing, I'm hearing a lot of these obstacles to accessing clean water from the capital that you need to lay down the infrastructure, to even households themselves needing to be built in a certain way so that you can pipe in the water, right? Or even addressing the delivery, especially in more far flung areas. But what are the other obstacles that you're facing in being able to deliver that clean water, especially in a country like the Philippines?
I think what makes the Philippines especially complex is we are an
Mhm.
archipelago. Often, what we experience, even during disaster response, is logistics, access to the network that will even bring the solution. The solutions themselves are portable, so this already addresses one issue of large scale infrastructure and the challenges of bringing that in remote communities, but still being able to bring these filters that are attached to buckets. So we use buckets because these are non intimidating household items. Often, when it's household items that are also unfamiliar, some communities who may not have had formal education, sometimes, indigenous communities will just think that, some things are too complex to use. So we want to make this as easy as possible. But getting these to these areas, what truck, what plane, what boat to put these through, and then the last mile delivery of these systems to these remote communities are what proved to be really tricky. So, what Waves for Water does is really capitalize and continue to build on. We call them clean water couriers. There are champions, essentially, our last mile volunteers who really know the community, who can speak the language, but also have some level of mobility so that they're able to pick up, from like airport cargo or bus cargo, the systems that we're sending out. But to add to your question, logistics is very tricky, especially in the context of being an archipelago in the Philippines.
A lot of people might easily assume that water is always available, especially because we're in an archipelago, right? Um, what are some other, I guess, misconceptions? What don't people understand about access to clean water that you wish they did?
So, when you think about access to clean water, you have to think about what they call the human rights based approach. That access isn't just about availability. So, obviously, the ideal is water is available 24/7. But if we recall, especially in Manila, back in 20, maybe 2019, there was a severe drought. So, even if we had piped in water infrastructure, people still had no 24/7 access. There was ongoing rotational shortages because we needed to manage the supply. So availability means ideally water should be accessible 24/7, and then accessibility. So even availability and accessibility, although they seem interchangeable, aren't. Accessible means, can people actually physically reach a source without danger? Are they having to walk long distances to fetch water and carry heavy loads on their backs? Are, people who are differently able, do they have access to the same water sources? And then you talk about quality. So there are different uses of water, and obviously certain qualities needed to make sure we're not getting sick from it if we drink it. But water is also needed for domestic use, sanitation, for hygiene. So we want to talk about quality when we consider varying uses. And then affordability. So can people actually afford it? Some areas have piped in water infrastructure or water districts, but are they able to afford the connection fee? Connection fees range from 5,000 to 8,000 pesos, and that's just to get connected. We work with some urban, informal areas, and Manila has centralized infrastructure,
Mhm.
but they aren't able to get connected, even if they had the money to, even if they save for it, because they can't provide proof of ownership or legal occupation of their households. They don't have the necessary paperwork, the ID, or their areas are contested, so it cannot, get connected to water supply. And then cultural acceptability. Sometimes there are interventions, even if they would make water safer. For example, chlorine tablets. Chlorine tablets are often used also in disaster response, but we've seen in some areas who are not used to the difference in taste and smell that they would rather
Right.
drink contaminated water. So there's these I guess, facets that you have to consider
Yeah.
when you talk about, access to clean water, because it's not just about access, it's about all these other things as well.
All right. So that's a lot, and I want to make sure I captured all of it. But there's the cultural acceptability, there's the affordability, the quality. Did I miss any?
And then the difference between accessibility and availability. They say that for you to move to a basic service level, you have to at least not take more than 30 minutes round trip for fetching water.
That's the gauge.
Yes, that's the gauge.
What does success look like? And do you have any specific stories that you like to share?
I'd like to think that the goal for a lot of nonprofits are the same because we exist to address a certain gap that's not being met, primarily by government, by services that's available. So once that gap has been met, then that's what success looks like. Pivoting or not having to operate to
Mm.
continue operation anymore just for the sake of it. So for Waves for Water, this means ultimately, ideally, having centralized water infrastructure for communities, but specifically for the gap that we address, which is that medium term, that gap between basic or even not basic, unimproved, the gap from unimproved to basic. That means kids being able to stay in school more, adults not having to worry and to walk longer distances just to find a cleaner source. And we've seen this in a lot of communities that we work with. So what's unique about the systems we implement is that even if they're medium term, um, they actually last the community for at least 5-10 years, and that's a lot of progress. A lot of progress can happen during this time frame, and we see this, for example, in jungle schools in Brooks Point and Palawan, where teachers report increased attendance and kids are able, to stay in school more and learn. And we've seen this also in areas where healthcare, access to healthcare is very challenging. So even, when you think about diarrhea, when we get diarrhea, I'm sure we've gotten diarrhea at some point in our lives. We never think of it as a life and death issue. In this day and age, nobody should be dying of diarrhea anymore. But in some areas, kids unfortunately do, because what diarrhea does is, diba, it dehydrates you. And if you're having to hydrate yourself with contaminated water, then that just worsens your condition. Healthcare access is very tough. You have to take multiple modes of transport, a boat, a tricycle, something
Right.
as time sensitive that needs to be addressed. And
Yeah.
this had reported savings ranging from 600 to 1,500 to access healthcare, for relatively simple. So we've had a lot of favorable and really positive, not just in terms of improving the access for these homes, but its impacts in socioeconomic sense and also financial savings, sometimes even from being able to use water. So you think you're addressing one thing, but really it's a rip.
Yeah, I'm seeing how far reaching the impact of having. So maybe you can tell us more about and partner with the community to make this positive change happen.
So the process is very consultative. You would think that with access to clean water, it should be common sense, or diba, something that you can actually prescribe because you see contamination, there's data of people getting sick, then it should be a no-brainer, quote unquote, that you implement the clean water solution. But that's not always the case. And we're very mindful of that. We talked about, a certain elitist approach, or sometimes coming in thinking you have all the answers. But the process that the process that we do is very consultative. We co-develop and co-identify the existing problem. So that's the foundation of it. There has to be acknowledgement from the community as well and its leaders that there is an existing issue. And that happens through a needs assessment. So that needs assessment will really show, okay, this is an existing problem, an existing issue in the community, and we are looking for ways to address that. Because that's the second step, them actually wanting or actively looking to find ways to help address the situation. And once we explain, the solutions that we have, so it's in the context of wash. So we have the filters, but we also are piloting water efficient toilets to address sanitation issues. And then we have hand hygiene stations.
When you say WASH, I understand it's an acronym. What does that stand for? What does it mean?
Yeah, so the acronym for WASH, or the acronym WASH stands for is Water, Sanitation, and Hygiene. So this is often a sector in the development world or even in disaster response because this is an immediate need that needs to be addressed to control disease, for disease prevention and spreading, and really to ensure basic health is provided for those that have been affected by certain disasters.
So it's not just when you say wash and when we talk about water, it's not just safe water for drinking. Then
Yes. It's
it
also having
covers.
water access for hygiene, for people to
Okay.
actually shower, to wash their hands. If we remember back in the height of the pandemic when there wasn't a vaccine yet, hand washing was the primary barrier for prevention. So hygiene is really the software to the hardware solutions of your access to clean water, whether that's filters, pipes, systems, and your toilets, because hygiene is really the behavior that's required, ranging from hand washing, um, regular showers or regular baths, and then also just in general, cleaning of our bodies and how we also prepare food and how we care for our members of the household, for example. So it's really the behavior change that's required and that needs to go hand in hand with the hardware, the solutions that are implemented.
So take us back to the needs assessment. What happens after you've identified the needs?
So you need to look at their water source, even disaster vulnerability, because even if they have water infrastructure, but they're always at the typhoon pathway, and that means their infrastructure is always getting damaged. Pipes get broken, water
Right.
sources get contaminated. So we look into their water source. We look into numbers. So reports of waterborne diseases. Do this happen seasonal? Is this year round? And then we also look into availability of toilets. Do households have their own toilets? Where are the toilets? Some communities actually have an aversion for toilets because of the thinking that why would essentially bakit dudumi sa isang lugar? Bakit iipunin yung dumi?
Yeah, the
Why would
cultural acceptability of the thing. Okay.
Exactly. And what
Right.
kind of toilets do they have? And where are these toilets sited? Are they near their water sources or are their water sources higher than the toilet? So all these things we take into consideration. But even if, a needs assessment concludes that there is a need for the solutions we can implement, what is also contingent to a project moving forward is availability of a champion, a community champion. So someone
Okay.
has to be excited, someone has to take ownership of the initiative, and somebody has to be willing to see that through in a community. It doesn't have to be an elected official. Often we do coordinate with the LGU, the barangay captain, barangay health workers, but sometimes we also see this in more informal roles, especially women and mothers. We see that when we actually work with them, because they know how water is a huge need and they're the ones responsible for it often in their homes. When we work with them, the use of the filters actually are often better guaranteed. So we look into the presence of a community champion, and then obviously there are funding considerations to take note of, but those are the two primary things to make sure that the process is shared, co-owned, and we only come in to transfer technology and help capacitate. After that, it's really up to the community to really make the best out of this new technology that's been transferred to them.
I like that you're looking at the communities not just as recipients, but as partners. And in many ways, they're the leaders who are driving this change in their community so that whatever intervention you bring in, it'll last well beyond, I guess, the time when you step out and let them implement or continue implementing those changes. Having said that, given the increasing frequency of typhoons, disasters in the country, how has climate change shifted the way you approach the work?
If anything, it's really just showed a greater need for preparation. As we know, the Philippines is one of the most disaster, typhoon, earthquake, etc. Right, we're in the ring of fire prone countries. So I think preparation is key. The systems that we implement are non-perishable. So our goal is really to equip communities with these systems even before something strikes, so that in the aftermath they have the option, they have, in a certain extent, still treatment capacity to use whatever existing water sources they have. Because often when you see also a call to support disaster response initiatives, water is often, top of the list. Plastic bottles, gallon containers, but these only last for how long the water in these bottles, exist to
Yeah.
be before they're consumed. So it's already logistics heavy to transport these water bottles. And then, they also contribute to single use plastic. And at the aftermath, especially of typhoons, you actually have a lot of water. It's just unsafe. So filters are actually one of the best and also sustainable ways to equip communities and households to better manage what they drink instead of just plastic water bottles. So for us, it's really more focusing on preparation, and that means working with disaster prone communities, whether that's through the LGU or existing grassroots organizations in these areas, and then making sure that we also have enough supply so that we're able to deploy as quickly as possible. Most recently, we have been exploring work with the Department of Social Welfare and Development, DSWD, to be able to really access not just government funding, but their extensive network of being able to bring these systems to a lot of communities in the immediate aftermath. So that's also been in the works and has proven to be also very beneficial.
Anika, one of the things that we ask some of our guests to do as part of drawing on hope is for you to also, maybe even just with a quick doodle, draw for us your vision for a future where clean water is not a privilege but a given.
What really, really got me thinking, and I can
Yes,
show it.
show and
So
tell. Yeah.
it's on scratch paper, but I don't know if you can see here. It's just two sides essentially of like a same drop of water, because I think water has the capacity to teach us what kind of world we're building. Is that one of extraction, or is that one of care? Is that one of individualism, or one of, understanding that we're part of a collective? So on one side, you can see here like extractive uses of water, because that's the reality that we have to contend with water. It's also seen as a resource. And with a resource, you have competing users. So you have industry, you have individuals, but then on the right is a more regenerative view of water, that understanding that we're a collective. If we see how indigenous people, for example, manage water supply, in some areas, water is seen as a living relative. It's not something to own. Nobody owns this resource. It's not even a resource. It's alive. It needs to be respected. It needs to be protected. So I think for me, and for us at Waves for Water, I think water should be seen, because you know how water can be very powerful. I mean, we see it now, it can destroy. And so it needs to be governed with that level of understanding and humility, that it's not a resource to be extracted, but something that is to be shared and managed across, across people, industry, and essentially multiple users.
So thanks for sharing that drawing. I like the idea of humility in the face of this resource that is both so basic, but at the same time, it's actually in many ways a big idea. Um, to have to think about access for everyone, especially for people who might be coming at it from a position of privilege where it's easy to take water for granted. As we wrap up, I wanted to ask you, Jenica, for people who might be listening or watching and feel compelled to help, but might be overwhelmed, where should they begin?
I think as individuals, often when we grow, growing up, we're taught in school about water conservation, and that means taking quicker showers or turning the tap off while you're brushing your teeth. But I think we also need to be mindful of our water footprints. There's a lot of talk about carbon footprint, but we also want to be considerate about the water we consume. And that's not talking about the amount of water we drink, but actually the industry that we support, our certain habits, our certain preferences. Even, for example, use of AI, Chat GPT, they say a couple of prompts already consumes 500 milliliters or 500 ml of water. So how we use technology, how often we buy and upgrade the phones that we use, because all of these need a certain input of water. And I think being more mindful of how we use these things will mean being more considerate about the water footprint that we're having.
Let's dig in a little bit into water footprint because it might be a new idea for people. So it's being mindful of not just the water I directly consume, but
Yes.
also being aware of the things around me, from the clothes I wear to the gadgets I use,
The
what's
food
the
we eat.
or the food that we eat, the beef that we eat, diba?
Yes.
Parang how much water does that also take up? So lay it down for me. What are some quick lifestyle considerations I should be mindful of to manage my water footprint?
So, in solid waste management, we have the three R's, right? Reduce, reuse, recycle. In water conservation, there is also the three R's, or actually, it's four. So, it's reducing consumption. This is something we already know. Reusing water supply. So reusing, recycling, and retrofitting. So, I'll quickly jump to the fourth one, retrofitting. So, for example, in our homes, where there are certain replacements we can make, say, a low flow faucet, a low flow shower head, or having a dual flush system can really help. Recycling or reusing, this can come in the form of collecting rainwater or gray water for use. This is actually something that's being put forward more recently in the Senate, a bill about rainwater collection. So actually, we do have a Republic Act about rainwater collection, but doing this at the level of our households, being mindful of the water that we use and also how we can reuse different levels of quality of water for other household needs. And then I think in terms of conducting an audit for how we can reduce consumption, and not that doesn't mean drinking less water, um, really thinking about the impact of what we talked about. If we like to buy clothes all the time, especially jeans, for example, jeans take a lot of water to produce because of the cotton and then the washing and the dyeing process. So, you look into alternatives of buying maybe secondhand or delaying, lessening how often we buy new things. The same with tech. AI is a tool. Then maybe there are other ways. There are other really compartmentalize and see where rather than having conversation with it or using it as program. And then also in the food that we eat. So the more is the more local you stay, then the lesser the footprint in terms. Then
Okay.
I think in terms of so I think in terms of behaviors, there are certain quick, easy audit that can be done. There's, what I say, there's always room. I didn't really have a scientific engineering to water. So coming from, an information design undergrad, but really being able to apply that in how we implement processes, how we make our work consultative has really been, one of the concrete manifestations of being able to use something interdisciplinary. So I would really encourage everyone who has some interest to really look into how they can contribute, not just by time and talent and skills, but how they conduct themselves individually and in their households, because there is impact there to be made.
Finally, Jenica, what's something that you've experienced in your work that continues to give you hope, even on days like this?
So what's I think amazing about being able to work in WASH and access to clean water is that it's not actually delayed gratification that you get. You see the work and the change firsthand. The first level is actually the magic that you're able to witness when you see people's eyes light up and they see their contaminated water, essentially their dirty water, look clear and clean, because we do make that clear distinction. And then after that is the return. When you hear about how this has helped the household, how, a sickly child is now able to go to school more, how a mom who used to walk long distances is now able to have more time, productive use for her time, then I think you see the ripple effect of the change. So the work is very rewarding. It's been such a huge privilege to work in a sector where the problem that you're solving is actually solvable, because then when you're able to see, in a certain extent, be able to, okay, tick boxes like this has actually been served already. So you're able to tick things off a map in a way, not to make it simplistic, but because you are serving different
Yeah.
communities,
Yeah.
localities, then you know where to move. It's very clear. I think what just needs more momentum is really awareness and support.
That's so beautiful. Thanks, Jenica. As we wrap up this episode, share with us how our audiences can connect with and stay up to date on your work at Waves for Water.
Okay, if you're interested about Waves for Water, we're online, we're on socials, we're at Waves for Water Philippines. If you're interested about hearing, the work that we do locally, but globally, we're at Waves for Water and www.wavesforwater.org. If people also want to get involved and you're looking for a sign, or you're already into running, walking, and fitness, then Waves for Water actually has a virtual run on Pinoy Fitness, our virtual run partner and platform. So it's a virtual run that people can commit to for a month. This starts from August 24 to September 24, and you can commit to any distance, 6K, 21K, or 42K, that you can finish for a whole month. And there's different tiers of support. So if you want to do something that supports the organization, but then also something that helps you and your health, then this is one of the most concrete ways that we want to build community and get more people part of the advocacy. Other than that, if you do have areas in mind that you'd like us to look into, or communities that you're part of that may have a need for clean water access, we're always open. We build a list of communities that we match with donors. So if you find a community or know a community that you'd like to nominate, our email is philippines@wavesforwater.org. We'd love to learn more and see how we can work together. And if you're already a nonprofit or organization doing some work and would like to plug in access to clean water or wash into the work that you're already doing, we'd also love to learn more and connect.
That's it for this episode of Drawing on Hope. A big thank you to Jenica for sharing their story and vision for a better tomorrow. If you found today's conversation meaningful, share it with someone who could use a little hope and inspiration. And if you want to hear more stories of change makers working to build a better tomorrow, don't forget to subscribe and leave us a review. It helps others find the show. Drawing on Hope is a podcast by Pushpin, a social impact design agency that uses drawings and stories to help make things make sense. Follow us at Pushpin Visuals on Instagram, Facebook, and YouTube, or visit www.pushpinvisuals.com. As always, keep drawing on hope, keep building a better world, and we'll see you next time.